But before we end, they say that good things are worth waiting for. And we have a fantastic keynote presentation. We weren't able to have it in the morning, but we have Dr. David Brown now with us online. He is the co-founder and chairman of HealthTech, and he comes from a long history within pharma. He has had roles with AstraZeneca and Pfizer. He's also one of the co-inventors behind Viagra. And today he has founded a company that works with machine learning to find treatments for children with rare diseases. And I think David will wrap up our perspectives on health tech in a really good way. So over to you, David, for your presentation.
Hello, everyone. I'll share my screen. Sarah, is that being shared okay now?
We see you, but not your screen yet.
Let me go back. You see the slide now?
No, we don't see your slide yet. If you would like, we could also share the slides from our side. But now we see it. Yeah, something is happening, David.
Just a bit slow. Okay,
yeah,
great.
Now we see your screen and now we see the presentation. Perfect.
Excellent. So yeah, apologies for the confusion over timing this morning. It was totally my fault. So what I'm going to do is very quickly, in about 15 minutes, 20 minutes, go through a very high level view of what's happening, mainly to give you an idea of the scale of the business opportunity. I mean, I'm a scientist by training originally, but I've also got a very strong business instinct. I've started several businesses here in Cambridge, as well as working in these big pharma companies. If we look at what's happened over the last 30 or 40 years, I'm fortunate that, I was born around about 1950 when all of this started, initial computers. And most of these things on this slide have come into place. I was actually trained in programming in Fortran in my undergraduate days, for instance, using punch cards those days, beginning of computing. And that's really matured enormously. But then in the 1990s, early 2000s, we had the human genome come along. Frankly, it wasn't ready then. And it's only sort of 2013 onwards, I think, when it became usable. And then we had the internet, really, with browsers from about the mid-90s that made it usable again. And then, really importantly, big breakthrough with smartphones, particularly the iPhone in 2008. Leading to lots of apps, and we've heard a lot of that about apps in the conference today. And that led to social networks, which allows people to share ideas and information. And then if you observe what a lot of people are doing who've got diseases, or aging people are sharing drug and lifestyle data to advise each other on ways to help themselves. That's leading to massive data being collected, what's called big data. And of course, to analyze that data, we now need machines to do it, machine learning, which is what my own company is doing, and many of the companies that presented this morning are doing. So all of that is leading to a transformation of medicine and healthcare. There is a big misconception, though, that the genome is everything. The genome is actually a very small part of it. And this is the genome here. So the genome is your DNA inherited from your parents, and the mutations acquired in your own lifetime as well. But actually, that is not the most important thing. Probably the transcriptome is the most important, which is how that DNA is being used at any moment in time. Much of it is silent, but some of it's being used. So, the very fact I'm presenting to you at this moment is changing the way the cells in my brain and probably the rest of my body express DNA. That RNA that comes up in the transcriptome, these are proteins, the so-called proteome. They go into biochemical pathways, metabolism, the metabolome. But then, coming along in recent years, we've realized that sort of 90% of the DNA in our body is actually in our guts, the microbiome. And there's increasing evidence that the composition of that microbiome has a massive effect on health. Then, the fact that we've got DNA, actually it has to be controlled. And the epigenome is methylation and acetylation of the DNA is controlling that. And and leads to the way it's being expressed. Okay, so there's a lot of data here, most of which we don't have at the moment, but over the next decades, this will all become very important. Why do we need health tech, though? I mean, there's a shocking publication that came out from the American Medical Association a few years ago. So this is Journal of American Medical Association, one of the top journals. This is actual data from medics in the US. If somebody in the US gets initial consultation in primary care, sent to a specialist, 50% of the data transferred gets lost. When they go from the specialist back to primary care, 25% of the opinions don't get back to primary care. Much the same with hospital. If they're in hospital, they then go back to their primary care physician. Nearly half the discharge records are wrong. And 75% of medical information after hospitalization comes from you personally, not from those records. Wow, that is a little bit scary, isn't it? If any of us are ill and relying on our physicians. Also, another reason we need big change is drug discovery. I mean, you've all heard of Moore's law. This is sort of quite famous now as Eroom's law, Moore's law in reverse. Just like the inverse of the increase in efficiency of chips, we've got the decrease in efficiency of drug discovery. So here, when I was born, we had a kind of peak of drug discovery. Here, when I started my career trying to invent drugs, I failed to myself help take it back up there. It's still going down. What I'm trying to do with my own company, Helix, at the moment is improve the efficiency here, still trying to do it. But it means that for each disease, the patient has a very low probability of getting better therapy if there's no therapy at the moment. There are a couple of books I want to recommend. Eric Topol, I knew a bit in the past. He's a cardiologist in Southern California, a really excellent guy. Professor of genomics as well. He wrote this book several years ago, The Patient Will See You Now, The Future of Medicine's in Your Hands. He published last year a new book called Deep Medicine, which is about AI in medicine. It really is worth reading. I can absolutely recommend it to you. I'll just give you a few quotes from his earlier book. Medicine is remarkably conservative to the point of being properly characterized as sclerotic, even ossified. Beyond the reluctance and resistance of physicians to change, the life science industries, companies that develop and commercialize drugs, devices, diagnostics, and government regulatory agencies are near paralyzed state, unable to break out of a broken model. Without the active participation of consumers in this revolution, this really is the critical point, the process will be inexorably slowed. All the other forces that come to bear, doctors, life science, industry, government, healthcare, incapable of catalyzing transformation. So he's basically saying it's up to each of us as patients, as consumers, as citizens, and as tech entrepreneurs. We've got to drive the change. I drew this cycle when I started my own company, Helix, in 2014, just as a very high level picture of my vision of where we're going to be. Maybe another 50 years it might take. But the steps of this are being put in place. We have to have a learning circle, not a linear process as we have at the moment. We have our genome, as I said, but then you've got to have all that other information that I had on the earlier slide, particularly the gene expression profiling. That may include the microbiome and other things. That information has got to be captured on the Internet of Things in real time. At the moment, everything is batch-wise, but eventually it can be real time. That will go into machine learning, expert health algorithms to analyze the data. That will predict, based upon the human record, the likely path of your own health based upon what's known for humanity in general. That will lead to personalized medicine, right device or right drug, change your lifestyle, or take this drug now. And then we'll monitor in real time the effect of those changes on your genome, on the epigenome and on the transcriptome, etc. Really a big vision, but all the presentations I've heard this morning are parts of this puzzle, parts of this cycle. And it's going to come to pass at some point. It depends on the Internet of Things. It depends on 5G. We're getting close to this being possible now, probably within the next 3 to 5 years in most countries. Wearables, sensors are being developed. They're still at a very basic level, I have to say. We need to find out much better ways of gathering that information with non-invasive methods. We need intelligent apps. We need real-time data collection analysis, massive data storage, way beyond what we've got at the moment. I'll come to that on a future slide. It will drive new consumer goods and business opportunities. And we're talking about a multi-trillion-dollar market here, absolutely massive. Because in the end, healthcare matters more to people than anything else, apart from food and personal safety. There'll be a massive reorganization of the healthcare industry, and I'll talk about that in a moment. And there's going to be an impact on healthy aging and future growth of the longevity industry. This industry could be the biggest industry of all, actually, even bigger than our current healthcare industry, because most of the world is aging, including China. I mean, China's now into its aging curve. It's not a young society anymore. But there are a lot of problems. We need progress. We need information security, seamless public-private cloud computing, agreement on standards. And these are difficult. Next generation analytics, new storage management technologies, data access tools and processes. And this is a big one as well, automatic tagging of data. I mean, I know from my own machine learning experience that data tagging is, in my own company, the core of the company is data curators, and it's always being done manually at the moment. We've got to get to the point of automatic tagging of data, an ability to deal with data in real time. But each of these is a big scientific, technical, and business opportunity. So this paper was published in 2015. I gave a presentation, I think that year or the year after, a big data conference in Luxembourg. And I made the point that this paper is saying that actually healthcare big data is going to exceed all other domains. But even in this paper, they've underestimated by several orders of magnitude the scale of the data that's going to be involved. Because they were talking about just genome sequencing, but the genome that's been sequenced so far has been just part of the genome. It's not been the whole genome. But even more than that, we need all that data, gene expression data, physiological changes, real-time diagnostics, prognostics, all those things I had on earlier slides are going to have to go into the databases as well, and live data collection. And that's really the healthcare learning circle. So the scale of data collection and analysis is going to be absolutely astronomical compared with in the past. That's going to lead to big changes in industry and in the business models. In the end, I've learned the hard way over 20 years that business model innovation is more powerful than technology innovation. There are many people with good tech ideas, but very few understand how to come up with a good business model that can actually get that tech through. But those coming in as entrepreneurs now have no legacy of the old systems, fewer barriers to adopting radical innovations. So I think we're going to have 3 business models emerge. There's obviously pharma biotech at the moment, but diagnostics is the big need. I mean, if you look at what's happening in healthcare at the moment, the mistakes in diagnosis are just absolutely awful. And then there's a big business model in the internet, and we're seeing the internet innovators like Google and Apple coming into healthcare because they realize the scale of this possibility. So we're going to have these 3 overlapping circles, and any company that can put those 3 together is going to be the absolute winner. Who's that going to be? Is it going to be the legacy pharmaceutical companies? Is it going to be the internet companies? Or is it going to be a diagnostic company, since this is actually the biggest obstacle at the moment, the biggest weakness? We'll have to see. Similarly, there's going to be a lot of different skills needed in healthcare. At the moment, we have government hospitals, national health systems, the medical profession, patients, public consumers, but all this is going to change. And again, anybody who manages to hit that sweet spot in terms of people is going to do very well. So I'm just going to leave you with this slide again. If you only remember one thing from my presentation, just remember this, because this is where we're going. I don't know whether it takes 30 years, 50 years, 100 years, but all the pieces of this are actually being put into place at the moment. And I think any business that can feed into this and fix some of the problems that are involved in this big vision has got a real chance of success. Thank you.
Thank you, David, for an inspiring presentation as always. It's really good to have you with us. And I think you ended with a fantastic slide with the life cycle. And as you said, you know, all the companies that we've heard from today find themselves in the circle in one way or the other. And I would like to just hear from you. You've heard the events from the morning. What has been the single most exciting thing that has stuck out to you from all the discussions and presentations?
You know, I was almost hoping you wouldn't ask me that because, you know, I don't want to be biased against any of the businesses. And what I'm going to say actually is just my personal interest. I've given presentations in London and in Cambridge at the colleges here on healthy aging. You know, being sort of 71 myself now, I have quite an interest in it. And it's a very popular presentation, but when I get to the last slide and they all say, well, what's your top recommendation? They're a bit shocked. And what I say is meditation,
Okay.
healthy mind state. Because what's the point of living a long time if you haven't got those things? But B, because there's now a lot of evidence that meditation and yoga have a massive effect on the expression of our genes, and big anti-inflammatory effects throughout the body. Chronic inflammation in the elderly is one of the biggest problems. It's probably one of the most causative of the aging process, etc. So I'm going to dodge your question a little bit and just say, actually, that's my personal passion. I've spent about 4 years of my life on intensive meditation retreats.
Right.
So I was very struck by the presentation that mentioned that, but that's unfair in terms of bias.
But I think you're pointing to something that's important, David, and we are seeing it increasingly where we're talking about the need to engage, you know, not just physical health, but mental health, not just physical well-being, but mental well-being, and seeing the body from a holistic perspective. And I think we're seeing solutions coming up to address this increased awareness of the mental space or the emotional space. So absolutely very valid. And David, you know, we met a number of years ago in Sweden, and I know that you're a friend of the Nordics. You wanted to be here if the situation was different, but we will find a way to get you here. But, you know, sitting from where you are in the UK, and you've heard a couple of the discussions on the great things happening in the Nordics when it comes to health tech and the use of data here. But from your standpoint, what makes us stand out in the Nordics? And how do you see our ability to create the next unicorn within health tech from this region?
Yeah, I haven't been to Finland or Norway, but I've been to Denmark and Sweden quite a lot, and I just love the countries. If I was going to live anywhere else other than the UK, it would be one of those two countries. I actually co-led a 7-day meditation retreat in Denmark a couple of years ago, and it was one of the best weeks of my life. I think the advantage you've got is that I think you've got a coherent society. There's something very good about societies of less than 10 million that are well governed. And I was struck by the comments on the data being collected across the whole population. And, we say that's happening in the UK, but the NHS is a bit of a shambles, quite honestly. It should be able to use the data, but the links with industry and with startups are very poor. If you can use the public collection of data in your health service and have sufficient access to help your biotech companies grow, you will have a big advantage, I think, over any other country in the world.
Yeah, so and you're touching on what the other challenge owners also said, the need to access data and to make it, to convert it into meeting a concrete need that we see in society.
Data is everything in this age. This is the data age. And any country that gets its act together on using data effectively is going to be the winner.
Very good. And David, obviously you have a long history experience working in life science and pharma, and now, in a digital health company. And of course, these are can be considered different sectors or different ways of moving ahead. But, and I know that you have prepared a slide. It will go out to everyone on, 15 points on how to succeed as an entrepreneur going forward. But if I had to put you in a corner, David, and if I could ask you to just share the top single advice to an entrepreneur in health tech, what would that be?
I'll give two.
All right. Okay.
The first is have massive ambition. Don't go for small markets. Go for trillion-dollar markets. Because actually the scale of venture capital around is so large that investors just don't have the bandwidth. They don't have the staff size to put money into companies that aren't going to grow into unicorns. They're all looking for unicorns and multi-unicorns. So, aim big. Don't be frightened to do that, because actually you'll fail if you aim small. You've almost got to frighten yourself with your own ambition. The second point I'd give is that think very hard about your co-founders for the company. Have you got the right team? But particularly, as entrepreneurs, you need a board, you need a chair for the board, and you need board members. That chair and the relationship of the founder with the chair is absolutely critical. I've been involved both as CEO of startups and chair of startups, and it really is central to success or failure, I'd say. If you can get a chair who really understands what you're doing, has domain experience, isn't interested in stealing your glory. They're not in it just to make money. They're interested in it to try and help humanity, and they will put the right amount of time into it. That will make a massive difference to you.
Fantastic, David. So ambition and having the right team to support that ambition as well. Thank you, David, for taking the time. And of course, your presentation and all the presentations from today will be made available as a recording after the event. And all the PDFs will be available as well to all attendees if you answer the survey that will be sent out after this event. But with this, I would like to thank everyone. Thank you, David. And we'd like to end today's event. And I really look forward to continuing the great conversations we have around health tech in Medicon Valley. My name is Sarah Dede, and it's my privilege to be a moderator for today. Thank you.